Hello my friends, welcome once again. My name is Dr. Saeed Kazmi. You're watching my YouTube channel. And today we'll be talking about assessment of a febrile child. National Institute of Clinical Excellence here in UK has prepared a very good tool. It is known as the traffic light system, and this is a guideline which is used and is recommended that you use it for assessment of a child who's got a history of fever. Initially, this guideline was prepared for assessment of febrile child who are less than 5 years of age based on traffic light system. So traffic light, the traffic light is green, amber and red. Green means you can go. Yellow means that you have to stop now because there is danger. And red means that there is danger ahead. You have to stop. So the same traffic light system is used in this assessment tool as well, and it uses this color-coded proforma for assessment of a febrile child. As I told you that basically it was supposed to be used for children less than 5 years of age, but I have modified it slightly so that it can be used for older children as well. And I have incorporated some more questions in it so it becomes more practical. So rather than being a guideline, this particularly modified format, you can use it as an assessment tool. And it is very good because it would help you in classifying a child who has got a history of fever, and you can do most of the necessary things that are supposed to be done when you are confronted with a child who has got a history of fever. So without further ado, let's start. But first thing first, if you haven't subscribed to my channel, please do subscribe, and also press the bell notification icon so whenever I upload a new video, you're always on board with me. So let's start. So if you look here at this assessment tool, so it starts with some of the preliminary information. So obviously, when you are using it in your practice settings, so you would be putting some initial preliminary information. For example, the name of the child. You would be putting some of the other identifier information like his date of birth, his sex, whether male or female, the date of presentation, the hospital number and age. Obviously, this chart goes in the patient file, so the patient identification information is over here. Then if you look at this chart, it says please tick mark appropriate sections and do accordingly. So this is a sort of an algorithmic approach. So you look at the boxes, you will read them, and you have to do it accordingly. And if you find something, you will put a tick mark in that particular box and then follow on. So this assessment tool is divided into two parts. The first part is for those kids who are less than 3 months of age, or in other words, less than 90 days of age. And the second part is for kids who are more than 3 months of age, but it can also be used for kids who are less than 3 months of age. How? The instructions are given over here, and in a moment I will go through that as well. So let's start with the very first section, that is for kids who are less than 3 months of age. Now we take fever in kids less than 3 months of age very seriously because the signs of sepsis can be quite subtle, and obviously they've got a weak immune system. So we are more worried when these kids they present with fever because we don't want to miss any overwhelming infection in these babies who've got an immature immune system, and that's why nobody wants to miss these things. So how do we start with them? We ask them, is there a reported or documented temperature greater than 38 degree centigrade at home or not? So if the parents report, because the parents are, or the carer is the one who give you the history, so if they say that they have noted that the child was having a fever at home, or they actually checked it with the thermometer and the temperature was 38 degree or more. So here it's important that if somebody says they had a temperature of 37.8, so we do not take that as fever in children lessons. So it has to be 38 degrees or more. So it can be 38, 38.2, 38.5, anything above that. So if they report they haven't checked it, or they have documented temperature at home, then if it's yes, then the first thing that you would ask is whether the child has been vaccinated in the last 48 hours or not. Many vaccinations, they actually activate the immune response. So those kids, they would be irritable. They usually have got fever, though fever in most of the cases are mild, but sometimes the immune system can go haywire and they can even have temperature which can go up to 39. So you ask about the history of vaccination. So if they've got a history of vaccination, then most probably that fever is being caused by the active immune system. So still, we look for any red flags. So if the red flags are not present, and by red flags we mean that the child is not too much drowsy, the child is not very pale, or is not having central mottling, or he has got a capillary fill time which is greater than 3 seconds, or he's very limp, he's totally off his feet. So these are, like, a variety of red flag signs. So we look for that. So if the red flag signs are present, then obviously that would be sort of when we call it red flag, so it would fall in the red box over here, and obviously these kids, they need to be admitted and workup needs to be done. But in majority of the cases, for practical reasons, if there are no red flags and no focal signs, no focal signs mean that there is no crackles in the chest, there is no wheeze, nothing, then you discharge them with safety netting and you advise them antipyretics. Two things important: safety netting and antipyretics. For these kids, safety netting is very important because these kids are small. So it's important that these babies are reviewed within 24 to 48 hours. So either you can do it yourself, you tell them to come back to you within 24 to 48 hours for a reassessment, or you advise them to go back to their family physician or GP so that the baby is checked, and if he develops something later on, that is not missed. So we call it safety netting. So the safety netting has to be provided to every child who's got a history of fever, and obviously if he has not any red flags. Number two, antipyretics. So these kids are advised to have paracetamol, and paracetamol is basically given to make them comfortable and also to address parental anxiety, because if the fever goes down, most of the parents are anxious because of fever for different reasons. And obviously when you give them antipyretics, so the fever would be, even if the fever is there, it would be mild and the child would be comfortable, he would not be crying, would not be irritable, so it helps. So antipyretics are advised that it should be used for at least 3 days. You don't need to give it for a prolonged period of time. 3 days is more than enough, because in 3 days these kids would be back to the normal. If there is no history of kid getting vaccination in the last 48 hours, then it's important to see if the child has got any red flags. Again, if the child is ill looking, the same red flags as I talked about earlier. If the child seems very ill looking or toxic or get red flags, then they need full septic screen. So they would come down in this red box and they would have to be admitted, and full septic screen has to be done. Now when we say full septic screen, so full septic screen means you have to do a full blood count with CRP, LFTs, UNEs, you have to do a blood culture, you have to do chest x-ray, you have to do urine culture sensitivity, and you have to do a lumbar puncture. This is the full sepsis screen. If the child is not ill looking and he hasn't been vaccinated and he's got a history of fever, then they need partial sepsis screen. So partial sepsis screen, you don't do an LP. The other thing you would only do a chest x-ray if the child has got focal signs in the chest. Other than that, you will do a full blood count with UNEs, CRP, LFTs, blood culture, and urine culture sensitivity. So that is partial sepsis screen, to see that you are not missing. UTI is one of the most common infections in children less than 3 months of age, so you don't want to miss that. So you would do a partial sepsis screen. If there is no documented temperature, there is no history, or means if you assess them at a triage and they don't have got a fever at that one, then you will follow the traffic light system below. So now you will jump down, you will ask certain questions, and you will see whether they've got most of the tick marks in the green boxes or in the yellow one or in the red one. So that's how you have to address a child who presents with fever or has got a history of fever and who is less than 90 days of age. Okay, now moving on down to those kids who are aged 3 months and above. For that, you have to look at their appearance and tone. So if you look at the left column, so the left column is telling you what you need to do, what you need to look for, and then you will be making tick marks in the appropriate boxes. So either a tick would fall in the green box, or either fall in the yellow box, or either fall in the red box. So the first thing to look for is appearance and tone. So you would look at the skin of the child. How is the appearance? So if the baby or if the older child seems to be of normal color, so he has got his normal pink color. He's not blue. He's not very much pale. Or if he has got just peripheral mottling. Peripheral mottling means there's marbling of the skin, which can occur because of the cold environment, and it is, we call it peripheral mottling because it only present in hands and feet, but the rest of the body has got good pink color. So you would put a tick mark then in the green box over here. You would also look to check tone in the limbs. If it's got good tone in all the four limbs, again the check box, the tick mark should be in this green box. If the parents say that he looked pale at home, I mean, at the moment when you are examining the child, he seems to be of normal color, but the parent reported paler at home, then instead of green box, you will put the tick mark in the yellow box. Or if you observe paler yourself, it's not a reported paler, but you, at the time of examination, you find the child to be pale, or he's got central mottling. So central mottling means that the marbling pattern is there on the trunk, it's on the chest or the abdomen. Or he seems to be very limp with a reduced tone. So he's very floppy. Then we'll put the tick mark in the red box. Next thing is to look for activity. For smaller babies, you look at how they are responding to the cues. So are they interacting with their carers, with their parents, whether they are playing with their toys, whether they smile, whether if they are sleeping. Some babies might be sleeping at that point in time because that's usually their sleep time. So if you awaken them, so what would happen? A child, normally a baby, if you awake them up from their deep sleep, so they are very irritable. They would cry for a while, but usually, if otherwise well, after crying for a while, then they would be well settled. And even the cry is a strong cry, it's not a weak cry. So if that is the case, you will put the tick mark in the green box. If they're not responding to social cues, I mean, there is no smile, they don't seem to be interested in the environment. If they are sleeping, they only get, you can awaken them with prolonged stimulation. So you have to rub them very hard to wake them up. Or if they are awake, there is very decreased activity, they're preferring to lie still, then you will put the tick mark in the yellow box. Or if they are totally disconnected from the environment, I mean, they're blankly staring, they appear ill, what we call as a toxic look. They are not waking up if they are asleep, or even if they are awake and they immediately go back to sleep, then obviously that's not a good sign, and you will put the tick mark in the red box over here. Then you look at the respiratory movement. So you would look at the chest wall. At the same time, during the triage, they would have put the SATS probe as well. So you would look at the SATS monitor to look at the SAT probe. You will do the respiratory rate and you look for chest recessions. So if you see that the child is having a relaxed breathing, or the chest seems fine, though it could be accompanied by any type of cough. So if the child is having cough, 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 but you feel like the chest is quite relaxed, it's not having any recessions, the breathing is relaxed, obviously he's got a cough. The cough might be troublesome, but still you would put the tick mark in the green box. The child has got signs of increased work of breathing. So if he has got a fast respiratory rate, which the upper limit is 50 breaths for a child who is between 6 to 12 months, and above 12 months or 1 year of age, the cutoff limit is 40 breaths. So if a child has got greater than 40 breaths, if he's greater than 1 year of age, or greater than 50 breaths if he's between 6 and 12 months of age, that is tachypnea, that is fast breathing. Or if he has got mild chest recessions, he's got very mild inward movements of the lower chest wall, we call it mild chest recessions. Or if he has got the O2 SATs, you look at the SATs monitor and the SATs are around 93% equal to that, or there are crackles in the chest, then you would put the tick mark in the yellow box over here. If the child has got respiratory rate greater than 60 breaths per minute, irrespective of the age, or there is moderate or severe, like inward movements of the lower chest wall, then you will put them in the red box over here. If it's also important these days that in all these cases, when you are looking at the the chest wall movements, you would always ask about COVID exposure. And it's very important these days because you never know if a child has been exposed to a COVID positive patient, and these respiratory symptoms along with fever might be the signs and symptoms of COVID. So it's very important that you ask about COVID in all the febrile kids, especially when you are assessing the respiratory system. You also look at the circulation. So how do you look at the circulation? So you would be looking at the skin and the mucous membranes. You would be looking at the capillary fill times, and you would be also looking at the pulse rate. So a child who has got normal skin, who's got normal eyes, they're not sunken, he's got moist mucous membrane. So you ask them to open their mouth, you look inside, and the mucous membranes are mouth and the central capillary fill time. So how you do that? You'll use your thumb and you press on the chest for full 5 seconds, and then you release the pressure, and you see when the color comes back to that particular area. So normally it should come back within less than 2 seconds. So if it comes back within less than 2 seconds, we call it the normal capillary fill time. So if that is the case, we'll put the tick mark in the green box over here. If the child is tachycardic, tachycardia means a faster heart rate. So if it is greater than 160 beats, these are the NICE cutoff levels. 160 beats if the age is less than 12 months. Between 1 and 2 years, the cutoff level is greater than 150 beats, and between 2 and 5 years, the cutoff level is greater than 140 beats. So if that is the case, then you will put the tick mark over here. Or if the child has got a cap refill time equal to or greater than 3 seconds, again, the tick mark would be in this section. If they got dry mucous membrane, so the mouth seems dry, the eye seems sunken, or he's got poor feeding. In infants, small infants, they are poorly feeding, or they have got reduced urine output. How do you know if they've got less than 2 wet nappies in 24 hours time period? So obviously then we put the tick mark in the yellow box over here. And if they've got a reduced skin turgor, so you use your thumb and your index finger and you pinch the skin between the umbilicus and the right iliac fossa, you lift it up and you release it, and if the skin doesn't go back immediately, that is reduced skin turgor. We will put the tick mark here, and we call that as a red flag. Then you also look for blanching rash. Now, blanching rashes are quite common. Most of the viral fevers in kids that would cause blanching rash. So a blanching rash of any severity. Any severity means the blanching rash is either just like, let's say, confined to the chest, or it's a florid blanching rash which is covering the whole of the body. So it doesn't matter any severity as long it is a blanching. Blanching means that you put pressure on the rash and it goes away. So simple glass slide test. So you take a piece of glass slide and you press it on the rash. So if it disappears and you see clear area beneath the glass, that's the blanching rash. So blanching rash of any severity would get a tick mark in the green section. If they have got a static non-blanching rash, non-blanching rash means a rash that doesn't go away. Static means that they have noted the non-blanching rash, but it's static, it's not spreading. So a few spots appeared, but those spots have stayed over there, it's not spreading. So we call it a static non-blanching. So static non-blanching rash, they would get a tick mark in the yellow box. If there is a swelling of any limb or non-weight bearing because of the swelling of a joint, then they would again get a tick mark in the yellow box. Or if there's a history of fever greater than 5 days. Now, most of the viral fevers, most of the trivial infections, they get better within 5 days. So obviously if somebody has got a fever for greater than 5 days, then we have to look for that. It might be signs of an occult prolonged infection like Epstein-Barr virus infection, cytomegalovirus infection, or it might be the symptom of Kawasaki disease or infective endocarditis. There's so many different reasons for prolonged fever. So obviously we need to find out the reasons for that and then treat them accordingly. Or if the fever is associated with rigors like severe muscular shaking, then obviously that also means that these kid gets a tick box in the yellow If they've got a bulging fontanelle, so bulging fontanelle is usually you can only feel it if the child is less than 1.5 years of age, or if the child has got neck stiffness, or if they've got a status epilepticus where they are constantly fitting, or they've got focal neurological signs like in the form of a unilateral dilated pupil or focal seizures involving one limb or one part of the body, then they get a tick mark in the red box over here. So this is how you would look at some of the basic parameters, and then you classify them either falling in the green box, in the amber box, or in the red box. Now, after this, you would do your systemic examination. And remember, no systemic examination in kid is complete unless and until you have done a head, eyes, and ENT examination. You would also put your stethoscope on the chest, hear for any noises or crackles in the chest. You would also do an abdominal examination, and you would do a musculoskeletal examination to look for any swollen joints, any painful parts of the limbs, etc., etc. So you do all these things, and basically you're looking for focal signs. So if a child has scored all the ticks in the green box, there is none in the yellow, none in the red, and they're all in the green. So you look for the focal signs. So let's say you find focal signs in the form of red inflamed throat or tonsillitis, and rest of the boxes are green, so you will manage them accordingly. So for example, if you think that the child has got tonsillitis, you will treat them with pen B. If it's just a viral URI, you might give them benzidamine to 0.15% spray, or you just like tell them to use ibuprofen or paracetamol. So you'll manage it accordingly, depending whatever your local guidelines are, or whatever, depending on your clinical knowledge. If the focal signs are absent, one thing that you need to do is do a urine test, because urinary tract infections sometimes can present just with fever and no other focal signs. So if the urine test shows you something, you can treat it accordingly. If none of these things are present, then what you need to do, you just need to give them the fever leaflet. You might need to give them safety netting, but you don't need to observe them further in the hospital. They don't need any admission, so they can go home safely. So you just give them reassurance. You tell them it's a trivial thing. It would either go on its own, or if you have given them some treatment, just tell them that it would go away with the treatment. If a child scores or has got any tick box in the yellow, so you might have 3 or 4 in the green, but then only 1 in the yellow, then you have to go according to the yellow box. So again, you will look for the focal signs. If the focal signs are present, you will manage accordingly, like tonsillitis, URI, pneumonia, UTI, you treat them accordingly. If the focal signs are absent, you will do a urine dip and culture sensitivity. If you find UTI, you will treat it accordingly with antibiotics, depending on your local guidelines. If you don't find anything, it's just a fever without any localizing signs, but he is falling within the yellow, then obviously you need to do a little bit of workup. You need to do a full blood count, UNEs, LFTs, CRP, blood culture, and you might refer them to the ward to follow up on the bloods, because if there is a high CRP or something, then obviously sometimes hidden infections can present in different ways, and they would need IV antibiotics. Otherwise, they might come up with everything normal, and they can be sent home with safety netting and advice how to treat it at home. If they have got any of the tick box in the red one, so let's say they have got a few in the green, a few in the yellow, but any single in the red. So if any single tick mark is in the red box, then you have to go according to the red box. So if the focal signs are present, again, you will investigate and treat accordingly. So you have to, the only thing is, because they are falling in that red, they might have to be given, instead of oral, if you are using antibiotics, they might have to be given IV antibiotics. But it's not a rule. I mean, your clinical judgment would decide. Or you might have to investigate it a bit, like doing a chest X-ray, full blood count. If the focal signs are absent, then definitely you need to work them up, because they're falling in the red box. So you will do a full blood count to look at the white cell levels. You will do the UNEs to see there are no electrolyte imbalance. You will look at the LFTs. You will look at the CRP. CRP can be mildly raised in viral infections. They can be highly raised in inflammatory or immunological conditions. You look at the coag profile, that it's not deranged. You look at the blood culture to see if there is any invasive infection going on. You will do a urine culture sensitivity, and if needed, you will do a chest X-ray to find any chest infections, or the child might need to undergo a lumbar puncture to rule out meningitis. All these things have to be done in patients. So these kids, they need to be admitted. So any child who is falling in the red box and the focal signs are absent, that child definitely needs workup. And that workup, as I told you, could be in the form of a full sepsis screen or a partial sepsis screen, or depending on some test based on your clinical judgment. But nevertheless, they would need to stay in for some time before you can rule out dangerous infections, or you might have to treat them for a while with IV antibiotics, or might give them other supportive treatments like IV fluids, IV painkillers to make them more comfortable, more stabilized, and after that you can then send them home with home care advice, with safety netting, and with appropriate follow up. So, to sum it up, this traffic light system is a very good system. It's a very good tool for assessing and classifying febrile kids, not only those kids who are less than 5 years of age, but you can use it for all the kids in the pediatric age group. You can very easily classify them whether they need to stay in the hospital or whether they need to be treated at home. And you can pick up most of the common infections by following this protocol. The chances of missing anything dangerous are reduced when you use such a structured algorithm. So that's why it's makes your job easy. So I hope you have understood this traffic light system of assessing a febrile child according to NICE traffic light system. If you still have got any questions, you can put it down in the comment section below. I will answer that as soon as possible. And once again, if you haven't subscribed to my channel, what are you waiting for? Subscribe. If you have liked my videos, press the like button and share it with your friends. And have a good day. Bye bye.